In its statement, UNAIDS urges media, governments and communities to respond with a rights-based, evidence-based approach that avoids stigma, with the programme's Deputy Executive Director Matthew Kavanagh warning that stigma and blame undermine trust and capacity to respond effectively during an outbreak like the current one. A significant number of cases have been identified among men who have sex with men, but UNAIDS points to available evidence suggesting that transmission risks relate to close physical contact and not limited to the aforementioned demographic. The joint programme has also urged all media covering monkeypox to follow the regular updates being issued by the World Health Organization.
Monkeypox is really a disease of close contact, and so the risk to the general public remains very low. However, direct contact with a person who may be infected or who has a confirmed case of monkeypox means that the risk is obviously higher. So what everyone needs to know is that the risk in general is low, and we shouldn't be concerned. However, if you are concerned about any particular symptoms you are feeling, then please do consult a healthcare provider and let them know what your concerns are. In addition, if you have been diagnosed with a case of monkeypox or you are concerned that you may have this, then the important thing is to isolate yourself. Do not have physical contact with other people.
Around 80 cases have been confirmed globally, mostly in European countries, but also limited numbers in Australia and Canada. The United States has one confirmed case in Boston, Massachusetts, and a further 4 suspected cases under investigation.
The patient was admitted on the 12th. They were being evaluated for various symptoms. During the course of their admission, they were identified as a possible monkeypox suspect. And this was really unusual because the patient had no travel history, no exposure to animals that would be known to be reservoirs. The risk factor here has been men having sex with men, and so that sort of close contact. And that makes sense because the way this is spread is through both respiratory droplets with very close proximity, face-to-face respiratory droplets, but also direct contact with the lesions that have virus in them.
The symptoms include fever, headache, muscle aches and swollen lymph nodes, in addition to patients also developing a rash, which begins on the face and quickly spreads to other parts of the body. While the WHO has established an incident management team to coordinate the international response.
The symptoms of monkeypox are described quite classically as being a rash that is preceded by a fever and feeling slightly unwell for a day or two. And then the rash is a typical rash, which goes from a red rash to vesicles, little blisters, to pustules, and then to a crust, and then the crust dries up and falls off. This is your classic situation of monkeypox, the classic description.
UNAIDS says the monkeypox outbreak illustrates that communities will continue to face threats from viruses and that international coordination and solidarity is essential for public health, as viruses can only be overcome globally. Their statement also notes the urgent need for leaders to strengthen pandemic prevention, including building stronger community-led capacity and human rights infrastructure to support effective and non-stigmatizing responses to the outbreaks. Sherwin Bryce-Pease, SABC News, New York.